Thank you, Governor, and good afternoon. I'd like to detail a new program run by the Mass Life Science Center to increase testing capacity here in our Commonwealth. Today, we are announcing more than $1.5 million to support 4 projects to provide alternatives to current testing stopgaps, expand testing locations, and provide further validation of tests already available. These funds will be made available through the Accelerating Coronavirus Testing Solutions, or ACTS, which is the program designed and administered by the Mass Life Science Center. This program will help identify innovative solutions to expand testing in the Commonwealth in order to provide new options and opportunities to testing centers while reducing their costs for administering and processing tests. You should think about this like the MERT program, the Manufacturing Emergency Response Team that was assembled to make PPP here in the Commonwealth. The ACTS program will support projects focused on 2 core areas: accelerating the development of simpler, faster, at-home and point-of-care testing methods, and identifying new and innovative solutions that address existing supply chain bottlenecks. The 4 ACTS awardees that will administer projects are 2 Massachusetts-based companies, Cafera Diagnostics and Virix Health, as well as 2 of our leading research hospitals, Bethersville Deaconess Medical Center and Brigham and Women's Hospital. As we continue to work together as a Commonwealth to overcome the challenges created by this pandemic, as we said before, testing remains essential to our fight and recovery from COVID-19. We look forward to working closely with these organizations, and I want to thank the Mass Life Science Center, led by new President and CEO Ken Turner, for spearheading this effort to fund projects that address these persistent challenges and support our recovery. As life science companies and institutions across Massachusetts continue to play a key role in our fight against the virus, the Life Science Center's mission is more important now than ever. In addition to the jobs and growth driven by our leading life science sector, the industry has stepped up during the pandemic to produce essential goods, devices, and therapies to treat patients and save lives. The investments made through the ACTS program will support the efforts of more of the cutting-edge organizations throughout Massachusetts that are ready to support our fight against COVID-19. We need as many tools as possible to win this fight and remain committed to providing the resources necessary to expand access and capacity for testing as we continue to work toward recovery. Thank you, and I'll now turn it over to Secretary Pizer to talk more about school testing.
Thank you, Lieutenant Governor. Good afternoon, everyone. I'm excited to be here today to announce this new initiative to provide schools and districts with access to frequent, affordable COVID testing for their students and staff. Universal weekly testing will provide an additional tool for bringing students back into their classrooms. But I want to reiterate what the Governor has already said this afternoon. As schools across the Commonwealth and around the world are demonstrating, and as the medical experts have confirmed, when the standard health protocols are followed, schools can be very safe places for children and staff, even without universal testing. Nevertheless, we all understand the anxiety that many people feel, teachers and parents alike, about returning to classrooms in the context of the current levels of COVID that we're experiencing now this winter. Today's announcement is intended to directly address those concerns in order to keep schools open and to help reopen those schools that have been closed. This pooled testing initiative builds on several other steps that the administration took last fall. Besides providing access to stop-the-spread testing centers in communities with high levels of COVID, the Command Center has been providing schools with on-site rapid response mobile testing in cases where there has been a suspected cluster. More recently, we have distributed Abbott BinaxNOW rapid test kits so schools can administer real-time point-of-care tests to students or staff who present symptoms while they're in school. Due to technological advances as well as the development of new cost-effective test techniques, we are now able to take our testing program to the next level. Specifically, the technology around pool testing has improved to the point where it is now possible to accurately evaluate 10, 20, or more swabs in a single batch. Local labs have also come online that are more capable of expanding capacity to deal with a significant increase in volume, which will be required to implement this level of testing across an education system of about 1 million students and staff. And finally, several promising pilot programs are up and running that demonstrate this type of school-wide and district-wide testing program is operationally feasible. Equally important, thanks to the recent enactment by Congress of the Phase 4 stimulus package, we will soon have sufficient funds at both the state and local level to implement an effective statewide program. Now that the conditions are right and the resources are in place, we are prepared to make a significant investment to get universal school testing program up and running as soon as possible in as many communities as possible. I want to thank the Governor and Lieutenant Governor for their leadership in making this a priority as we enter the second half of this school year. And I want to thank Commissioner Reilly and his team, as well as Secretary Sutters and all the folks at DPH and the Command Center for making this day possible. I'll now turn the podium over to Commissioner of Elementary and Secondary Education, Jeff Reilly, who will provide more details on the program.
Good afternoon. Thank you, Secretary Pizer, and thank you to Governor Baker, Lieutenant Governor Polito, and Secretary Sutters. By launching this new pool testing initiative, the Commonwealth is adding another important component to our COVID testing strategy in schools. Weekly pool testing will be in addition to the Abbott BinaxNOW rapid tests currently used in schools to test symptomatic individuals, and the mobile rapid response units that are already deployed to schools when necessary. Pooled testing is not required to provide in-person learning. This is a voluntary program open to all public schools, districts, charters, special education collaboratives, and eventually private schools. School districts providing in-person or hybrid learning will be prioritized for testing kits, but schools in remote learning looking to bring students back to classrooms can also participate. DESE and HHS are finalizing a statewide contract that will enable schools and districts to work with testing service providers who will coordinate with the labs. Pooled tests will be analyzed at a local laboratory and results will be turned around quickly. DESE will assume the cost for testing during the startup phase of the program. We estimate this cost to be between $15 and $30 million. Following the initial launch, districts and schools may continue pooled testing by purchasing tests through a statewide contract that is being stood up using their federal stimulus dollars. DESE will be sending an overview of pooled testing to superintendents, charter leaders, collaborative executive directors, and approved special education leaders. This memo will include a link to our informational webinar that happens next Tuesday and a link to an interest survey. Using pooled testing with students and teachers, we will have one more tool to quickly identify infected individuals and their close contacts in school settings. There are a few school districts in the state that recently launched pooled testing, including Salem, Watertown, and Medford, and a few others are beginning soon as well. We are encouraged by the early results they are showing and by the information gathered from this method to help guide informed decision-making. Districts using pooled testing are seeing low positivity rates among students and staff within the schools. Watertown Superintendent D.D. Galston said it has allowed them to stay open despite the rising virus in their community. They have not had to think about closing their schools, she said. Since recently starting this initiative, Watertown Public Schools has tested more than 6,400 individuals, including students and staff members, and has seen a positivity rate of 0.21%. This is compared to the community rate of 4.4% as of December 31st. The superintendent told us what the testing is really helping to see is that the core mitigation strategies used in schools, masking in particular, are working. Pooled testing is an important development for our schools, and I just want to take a minute to thank my staff at DESE, particularly Senior Associate Commissioner Russell Johnson, who will be leading the initiative, along with Lauren Wu, as well as Secretary Sutters and her staff, who have all worked hard to make this possible in a very quick turnaround. Thank you, and now I'm going to introduce Secretary Sutters.
The
Governor, Lieutenant Governor, Secretary Pizer, Commissioner Reilly, everyone, good afternoon. A little more detail about how I'm going to go into a little more detail on how pool testing works. We continue to carefully monitor the data around transmission in schools and believe that with proper mitigation strategies in place, transmission occurring within schools is rare, as you've heard from Commissioner Reilly. We've seen others support this viewpoint as well. According to the December released Rockefeller Foundation report, and I quote, "There's been not a community outbreak traced to an elementary school, and contact tracing studies have found that children are almost never the source in infection clusters." That said, we know there are concerns, and they are high for some students and families, and we want every tool to prevent and detect spread. Now, as you've heard, we have a powerful new tool in our toolkit that didn't exist in the spring and was a concept at best this summer: pool testing. New pool testing, along with rapid point-of-care tests, the Abbott Binax Now, enable a shift to proactive surveillance testing models. Pool testing allows low cost and greater expansion of COVID-19 testing. It is at least 75% less than the cost of an individual test. As Governor Baker said, we plan to build off the infrastructure of our successful rapid testing Binax Now program to support the range of tangible benefits that come with safe in-person instruction. We expect to accommodate all interested publicly funded schools during the 6-week initial launch, creating opportunity for many students in the Commonwealth without regard to grade level or geography. The pool testing program that is launching will test students, teachers, and staff once per week. We will monitor the data and adjust as necessary. So what is it? Once schools go through the orientation and onboarding and the webinar that starts next week, that includes the training on procedures, protocols, and consent forms, they will be supplied with testing kits that contain all of the materials they need. The tests are short swabs that only go in the front part of the nose, completely painless, and I will avoid the description given to me by my staff. The swabs are collected and placed into a single tube to be transported or shipped to the laboratory. So if you think about it, 10 swabs in a tube. That is pool testing. Schools will have a very simple technology provided by the testing services providers to track each tube containing the samples from a classroom cohort of students or staff. At the laboratory, technicians take all of the samples out of a tube and then combine them into a pool and run a single laboratory test to determine whether the pool is positive or negative. The results of each pool are reported securely back to the school, and we are planning for 24 to 48 hours after the samples arrive at the laboratory. If a pooled test result is negative, then all individuals within that pool are presumed negative and they remain in school. If a pooled test result is positive, then all the individuals in that pool are retested using the Abbott Binax Now, and the positive individual and any close contacts are isolated to quarantine. This allows classrooms to stay open. This approach increases the number of individuals that can be tested using the same amount of resources as a single PCR test. We realize schools need support in this endeavor: webinars, training staff, clear, understandable, and easy protocols, and assistance when issues arise. We are working with our pooled testing providers to provide these supports. Additionally, to help schools after the initial 6-week launch phase, the Commonwealth has centralized the procurement for pooled testing services and providers. Schools will be able to continue their testing programs after the launch phase by purchasing from a standardized state contract and prices. We are pleased at this next stage of providing pooled testing to keep or open our schools, but we know testing cannot eliminate the risks of infection entirely. This is one important tool in the entire toolkit. That's why it is critical to continue with the mitigation strategies we've been using since the spring. Wash your hands, wear face covering, keep your distance. We're excited to get pooled testing off the ground, learn as we go. Speed is the need, and lead the nation in working together to keep students in our classrooms safely or get them back to school.